Yeah, so our session was basically about models that are already in existence. So there's already a lot of community members and healthcare included that are working outside of the healthcare box and having conversations about what matters most to them and what matters in terms of advanced care planning, not just the clinical, but also the values-based. And so they're doing that already.
So the why behind this session was that, we know that advanced care planning is important, and there are several work has been done in terms of advanced care planning in hospital settings, but the many practitioner clinicians in hospitals often say that it is too late if we have this conversation in the hospital. So that we started thinking about upstreaming the advanced care planning. So that we need to start thinking about it should be done in the patient's home. It should be done outside of the hospital walls. So that is the kind of behind the reason why we have this session. And so we go out to the community and who is doing what and how we can reach out to the people in the community.
We talked about a couple of models that engage key community partners like faith-based organizations and legal aid organizations to help pull in vulnerable populations or populations who don't have great access to the healthcare system.
I think the one big thing I took away is that people really want this in the communities, and so the groups that presented in our session showed that it's not doing to or for, but it's doing with communities, and I think that's really critical. And there are a lot of really great examples, as you mentioned, working with the legal aid, working with faith groups, working with those that are already meeting in the community and those who are already tapping the assets that exist. So it's going and finding those assets and working within these existing structures. And community members are really, I think, our most untapped resource in healthcare. They want conversations about healthcare end-of-life issues. And we know that we've done some studies that 90% of Americans want to have these conversations, but only 32% are having them, which is an increase from 5 years ago. So only 27% were having those conversations. So people want to have this, and they want to have it in the comfort of their home. And I think our session showed that there are so many different ways to do that, and so many groups that are already doing that to learn from.
Yeah, I think that's exactly right. And there is a lot of work happening in the community in parallel with the healthcare system, and often but not in coordination with the healthcare system. And so from the medical legal partnership perspective, we've learned a lot about how to make advanced care planning more effective. I think our healthcare partners have learned a lot about the legal considerations in advanced care planning, and it's really elevated our game all around, and we learn a lot from each other. So we are all accompanying one another in this journey as patients and providers of all kinds of services.
I would actually say the one thing is that all of us here, if we haven't already, should have these conversations about what we want in terms of our end-of-life wishes with our family members. And so we often say we should walk the talk and exemplify that in our own work. So doing it first, and it's the one condition, so death is the one condition that we will have in common with everybody. So as you go through and have those conversations yourself, it makes it easier to work with patients and families when they do come into the medical setting. So having it happen in the community and knowing that communities want to have these conversations, even though it's difficult, once they start talking, people really love that opportunity to talk about what matters through stories. And I think that bridges the gap, as you were talking about.
So in addition to that, we found a lot of allies outside the healthcare system. We also talk about a lot of tools available, and that was very useful. But the participants asked a question, which tool is the best tool to use and when is the right time to use those tools? And our response was that it depends, but we really need to, so that brings us back to the point. I think the key is that we really need to know who are the people and what their needs are. Then we can find out which tool is appropriate to use or the best suit for this person.
So I think one takeaway I had thinking about one of our colleagues' presentations was just the importance of addressing multiple dimensions of patient planning. So in her Navigator program in Alameda County, they look at, social condition of the patient and medication management and a whole range of things that affect the context in which patients are making decisions. And I really felt kinship with that. It's very similar to the medical legal partnership model, in which we're thinking about not just advanced directives and PULSed and goals of medical care, but goals of living and the conditions we need to have in place: housing, income, social supports, a whole, financial caregivers who can really take care of us. These are all really important elements of advanced care planning that we should be thinking about when we're thinking about how to address a whole person and their goals.
I love that framing of it, and it's also in some of the work that was presented, we talked about equity. And so when you go out and work with the community and really figure out who is the diversity within our community, tapping into those who are typically marginalized, and when you get out into the community, you can actually identify better than in the hospital itself, because we're not reaching everybody in the hospital. So in that respect, a lot of the tools and the programs that are being used can be used to make sure that we are not furthering inequities in health, but actually reaching everybody within the community once we identify the leaders and work with those leaders that are already there. I think a lot of the groups have tools, so it was just a snapshot of what was presented, but each of the groups, and I would encourage people to go check out the websites. So Prepare for Your Care, I'm sure the legal work that you're doing has it. I know Conversation Project has a lot of resources, the Hello Game, Go Wish, all of the groups that we're presenting, they have, as part of the work that they're doing, they have some additional resources on how do you reach community members, and how do you gain the skills. So I know we have a course for providers. It's called an open school course, but it's how do you talk with your patients and family members about advanced care planning, and it's a free course that you can take. And I'm sure that others have some of those resources. So I think there are a good number of tools that we just need to uncover and make sure that everybody is aware of them.
I would just add the National Center for Medical Legal Partnership website. We also have a toolkit called the Dementia Care Ecosystem Toolkit that incorporates decision making as part of a more comprehensive set of tools that health systems can use to address dementia care upstream.
I think, just reiterating on the other point, I think right away when you think about how I'm working with patients and families, it's all about conversations. And it's conversations about what matters most to you, whether you're coming in for a well patient visit or you're coming in for palliative and hospice care. So I think they can tap and use these tools right away to ask the questions about what are your values and what are the non-clinical questions that we can be asking. And then those values will then shape how I'm going to practice and bring in the extremely important medical conversations and questions afterwards.
There are many people working on this, but I would really love for healthcare teams to think about listening to patient stories for the non-medical goals and wishes and factors that may be influencing their care. So if they mention something about housing or economic stress, those are really important factors to address in tandem with medical care, and I hope will be considered and adjusted as part of the care plan. And if you screen for just one thing in advanced care planning that is not an advanced directive, screen for a responsible financial caregiver who is legally recognized. So a durable power of attorney for finances for patients who have serious illness.
As a healthcare provider, I usually focusing on those medical decision making, and when I'm providing the training for the clinicians, they often stick with the medical framework only. But the patient is not living in the hospital only. Patient living their own life outside of the hospital, and other than the medical issues also impacting on their lives. So I think throughout the conversation of exploring their values and the goals of care, we also learned that what other things important to them, and we need to find out, including other team members to bring them in and really dealing with that, okay, so this person may have the medical problem, but also having the housing issues or the legal problem. And so we need to really work together to providing this holistic care to the person. And to that extent, I think it is very important to be the go outside of the box and not just limit it ourselves just within the healthcare providers only, but we really need to reaching out to the legal, the collaboration and the looking for the faith community, looking for the more grassroots support for the patients and healthcare workers for the volunteers, and so we really need to work together to providing the holistic care, not just the medical.
And I think tapping into those expertise outside, so you don't have to do everything yourselves, because there are experts in our community that are really willing to partner and to collaborate. And so if you find those leaders and collaborate with them, it's going to lighten your load and tap into the expertise. So with the faith leaders work that we heard about today, who are the faith leaders that we can build relationships with and get to know what we can do and what we can learn from each other. And there's some great examples out there of healthcare systems that have created a panel, so faith groups and faith leaders and healthcare practitioners come together and talk about what matters to each of them. So it's joint learning, so it's kind of the two-way learning.
So I try to provide the advanced care planning class to the patient throughout the primary care settings. And it was really difficult to bring in the patients in to attend our class. And I realized that this is not working. And so who is doing a good job in this area, really reaching out and working with the patient who are living in community? So then I realized that I need to learn from the people who are successfully doing this. So that is a kind of behind the scene. And so this panel, great panel that we have together, is all serving for my selfish purpose of the learning about what is available there, what is a successful program doing, and how to do it. So that is a kind of behind the decision.